Rahman with the Women's Healthcare Group of Illinois. Dr. Abdul Rahman, this is the point here, which is critically important. You can't simply reduce this to listen to your doctor about your health, because when you're talking about this coronavirus epidemic, you have one hand, you heard Malik talk about PPE. Well, that's where Donald Trump and the federal government plays a role, because you need to be able to properly look at in terms of what do we have in terms of available PPE. Donald Trump kept lying to the public by saying, "Oh, it was left barren," when in fact a report came out today showing there were 16,000 ventilators that were actually in the federal stockpile. And so you can't say, Doc, don't listen to Donald Trump, when if you are the president and you are responsible for how the federal government responds to this in getting out PPE to states, those states getting them to hospitals and ventilators and testing, if you are denying the reality of all of this from the beginning, then all of that ends up being a problem.
Absolutely. And this is the thing, what people don't understand, when COVID first hit the scene, it's called the novel coronavirus for a reason. It's novel. We don't know much about it. But being on the front line was frightening. Yes, as a physician, as a healthcare provider, I know kind of what to do. Again, it's novel, so we don't know everything. But you need support. No one person can do this alone. And that support has to come from on high. We literally, we were in the hospital with COVID-positive patients wearing ponchos from Six Flags. They were kind enough to donate it. Thank you very much, Six Flags. But that was not proper PPE. We were wearing the same N95 masks for months. That, again, is not proper PPE. That is not the proper way to wear PPE. We did not have the guidance that we needed from the top. And without that, no matter what you do or don't know, if you don't have the materials that you need, if you don't have the equipment that you need, you cannot take proper care of patients and you cannot take care of yourself. And I think that is the fallacy in saying that, don't listen to the president, listen to your doctor. That's true, of course, listen to your doctor. But being real, you're going to be in the room with your doctor for 5 minutes, maybe 10 minutes, whereas the president has that bully pulpit. He's going to be on Twitter. He's going to be on the news saying the nonsense that he says 24/7. And so the discussions I have with patients are discussions I shouldn't even have. We should all come with an understanding that this is a virus, this is highly contagious, this is dangerous. We should all be there, and then we can move from that on to what we need to do. But when your first discussion with the patient is, does this really exist? Is this a hoax? Is this something that is being created? You don't really have the time that you need to actually take proper care of that patient when their knowledge base is starting so far behind. So yeah, absolutely. The president is a president. He's not a doctor, but the president is somebody that sets the tone. And we would hope it would be somebody who would be getting information from doctors, listening to that information, and then passing it along to the American people, because he can reach way more people than any one physician can.
And when you also are talking about when you have someone who openly has disdain for masks, who will tell journalists, hey, take it off, don't worry about the person next to you is not concerned about it. You're going, okay, you do know that's the one thing that we're not supposed to be doing. And again, Doc, surely it has to anger you to see him at a rally being flippant about a virus that has killed 120,000 people.
I have to tell you, Roland, there were so many days when I was almost in tears, because it is truly like a tale of two Americas. Like, there are people that seem to think that this does not really exist, or it's not as bad as you think it is. I'm telling you, in my hospital, I'm in the northern suburbs of Chicago, we have an ICU that has 26 or 30 beds. There was a point in March, April, and May when our ICU was full, and we had not one, not two, but 3 overflow areas that were full. And these were patients, like, literally, I was on call one Saturday night, and I literally started crying in the call room because I heard code blue, code blue, code blue, 5 code blues in one night. And yeah, when people pretend like this is not something that's serious, it absolutely is. And it's not just older people that become ill. Middle-aged people, younger people become ill. But let's just say it were only older people that become ill. We can't just sacrifice people. We can't just sacrifice people and pretend like they're not important in society. So yes, when you see Donald Trump not wearing a mask, not only encouraging people to not wear masks, but bullying people that wear masks, it is infuriating, because again, people can say, oh, he's not a doctor, he's the president, but for better or for worse, people look to their president as a leader. And it is infuriating when the science is so clear. This is a virus. It is spread through respiratory secretions from your mouth, from your nose. Wearing a mask will prevent 90+% of that transmission. And then to not only not wear a mask, but then squeeze people into these arenas where they're yelling and screaming and hollering on top of each other. It is, I mean, in one sense, it's mind-blowing. I was talking to my wife, like, 3.5 years ago, this would have been mind-blowing. Now it's just like, this is Donald Trump doing what Donald Trump does, and that's kind of a sad state to be in as well. But yeah, it is, as a physician, it is absolutely infuriating that he is allowed to get away with this. And the sycophants that support him, it's mind-numbing. It truly is.
Well, it is certainly difficult, I'm sure, for those first responders, the people who are on the front lines with trying to care for people, not having enough PPE, not all those months having to wear the same mask weeks at a time, even though that violated all medical protocols. And again, that's what happens when you don't take this thing seriously. And let's not forget, Donald Trump said, oh, this is just one person from China. Then it was, oh, we have 15 cases, we'll be soon down to 0. Oh, you have Larry Kudlow who said, oh, no, we've got this as completely under control, as airtight as possibly can. And now, June 23rd, 120,000 people are dead, and we're seeing dramatic increases in Texas, in California, in Florida, in other states. This is not going away. So it would be nice if Donald Trump could take it seriously. Dr. Abdul Rahman, we surely appreciate it. Thanks a lot.
Thank you.
All right, folks, let's go to the breaking news out of Kentucky. Today is primary day, and we told you the problem there. 3,700, normally 3,700 polling locations in Kentucky. Today, just 200. This is video from the folks at Black Voters Matter. People who were in, go to my iPad, please. These are people who were in line,